Getting a job in Nigeria is actually very easy. The problem is that
you are a medical doctor.
Imagine your doctor start shouting Jesus, Jesus. Even you self, you'll be afraid.
What do you think are the two skills that actually helped you to give you unfair advantage to get the job?
You might have all the grades and everything, but if you do not have...
Now, we want to talk about your professional career. Now, you are a medical doctor, and it's not an easy thing to actually graduate and get a job, I believe, in the medical industry if you don't understand your onions. Now, we would love to know how did you get your job?
Well, so currently I'm doing my housemanship. So it's very simple. You apply to the hospital. They ask for your credentials, your certificates, then once they vet it, they look through it and you get it. It's not really that. Being a doctor in Nigeria, getting a job in Nigeria is actually very easy. The problem is that people don't want to stay in Nigeria. You just apply. They do an interview, and after the interview, they give you the job. So it's not really that complicated at all. For doctors, it's not.
Okay, I'm curious now.
They are looking for us. They are begging us.
You're hyping yourself. No.
And then they rush us.
I know that medical doctors and nurses are on the run. You guys just want to jabber out of this country. But as well, we will value the ones we have access to. Now,
Thank you so much.
That not everyone that applied to, I believe, that applied to the University College Hospital at Ibadan actually got the job or got the housemanship. Yes. I believe that is a screening process.
Yeah.
Yes. So what do you think are the two skills that actually helped you to give you, I believe, unfair advantage to get the job?
Okay. Well, I think it was kindness because it was less about credentials, because during the whole process, they were not doing like full-on interviews, but the HR, the human relations people, they were very receptive towards me because simple things like greeting, they didn't give some people accommodation and a lot of things because they were aggressive. They didn't speak to them correctly. But when it came to my turn and I was like, good morning, ma, this and that, etiquette and respect is something that is valued so much in medicine. And I think people should not neglect that fact. You might have all the grades and everything, but if you do not have respect, if you don't have loyalty, if you don't have ethics, you are not a full-on.
Wow. There are two C's when it comes to being relevant in our world, and character, competence. These are the two C's. You must have the character and you must have the competence in whatever you do. Competence gets you past the gate, but character sustains you. You might be competent, but then again, if you don't have the character, the proper character, people that are much more competent might actually replace you if you don't understand your game. So it's a wonderful thing.
True.
A wonderful thing. Now, I would love to know now. You serving doing your housemanship. For students that don't know what housemanship is, please can you actually break it down for us? What is actual housemanship?
Okay, housemanship is a 1-year program that you do after you become a doctor. And this program is actually how you pick up the major skills you need as a doctor. So you go through 4 major units, which is medicine, surgery, pediatrics, and O&G. In each of these units, you spend 3 months in each unit. That's the total of 9. Is it 9, 11? That's the total of, wait, let me see. Yeah, 3 months. That's a total of, 11. Let's see, 1, 2, 3, 4. It's 9 months, right? Wait. Oh, sorry. It's 9, right? Am I sure? Yeah. So you spend all this month, you spend a total of 3 months in each of them. It's not 9, it's 11. You spend, let's see, sorry. Why am I making a mistake? Let's see. Okay, 12 months. Yeah, 12 is the entire 1 year. I was doing 3 times 3. So now what you do is that you spend a total of 12 months in each of them. But in each of those 3 months, you have a 1 week off. That's why I was like 11 months, then 1 month for your break. So you spend a total of 12 months, that's 1 year, and you're supposed to pick all your clinical skills. That is your skill in medicine, your skill in surgery, your skill in pediatrics and O&G. Now, this is not where you start your residency. This is where you get your foundation of being a doctor. It's actually very important here. And this is where you choose that, okay, fine, I want to be a cardiologist. Oh, I want to be in medicine. Oh, I want to be in surgery. So after your 1 year housemanship, you can now choose where you want to specialize as a doctor during residency. That's it.
Wow. That's quite a journey for you guys. It's not an easy thing to become quote unquote a doctor. It's not being, you guys are really, really trying.
So
whenever I see blood, God, I run away from it. I want to know from your journey so far, what are at least 3 challenges that you actually faced, in your housemanship or on your journey to becoming a doctor? Yeah.
Cool. Okay, so I would divide it into 3. Number 1 is a personal challenge. Number 2 is a structural challenge. And number 3 would be a more like an external challenge. So number 1, personally, it was not a bad challenge. It was a good challenge to stretch me so I can become a better doctor. And this was learning some skills that I've never tried before, like IV line setting. IV line setting, oh my gosh. Now I do it so well, but a few months ago, I was struggling, especially during an emergency situation, trying to find a vessel to pass fluids for a patient, and that personal one was being able to cope with the stress and the pressure during an emergency situation. Now, in an emergency situation, I would not be stressed. My mind is straight. That's what they say. They say doctors don't have conscience. It's not true. When you're shouting, Jesus, 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 help him, help him, we cannot be shouting Jesus. We're supposed, imagine your doctor start shouting Jesus, Jesus. Even yourself, you'll be afraid, right? So learning how to be straight in an emergency situation was something that I really learned. So these are good challenges. The second one is a structural challenge. And this is, the system is very bad, and I hope that it can be resolved. Some patients, when they need oxygen, there's not a already existing oxygen. They have to buy oxygen separate from their admission fee. You have to carry your patient upstairs. The logistics in the hospital system here in Nigeria is still very, very not proper. And I hope that it's going to be fixed. And personally, I hope I can invest into the system to make it better. Then the third one is external, and this is for our patients. A lot of patients cannot afford healthcare, and there's little or nothing we can do about it. I know a lot of patients that I was able to assist them in paying for their fees, but there's still many more that I'm not able to help because I'm not yet a full-blown philanthropist, but I will soon be. So yeah, and patient health out-of-pocket payment is a challenge, and I wish our NHIS, Nigeria Healthcare Insurance Agency, currently can help improve access and payment of people who cannot afford healthcare. And myself, my philanthropy association is coming very soon. Valerie Okorie Philanthropy Association is going to come very soon. We're able to also relieve the burden of out-of-pocket payments for patients in Nigeria. Yeah.
You've not mentioned the external.
That's the external. I said personal was the challenges that helped me grow better. Then second was structural. The Nigeria system, the hospital system is very bad. You cannot imagine there's an emergency situation and you have to go and get a case note and you have to carry the patient upstairs yourself. You want to buy oxygen, you have to go and get the oxygen yourself. All those structural systems are very shaky and they need a better structure. And the external was for the patients, right? They are unable to pay their bills and we hope we can help them. That's it.
Wow. Something that just came to my mind. I truly love the way you communicate. You're actually a prolific communicator, and I love that. And you're also good in storytelling.
Thank you.
You mentioned something about your philanthropy. Before we touch on that, you are really, really doing a lot. I would love to be like you when I grow up. You employ me very soon. All right. Now,
I asked you that you work with me when we were younger. Have you forgotten?